Hi, my name is Taylor, and I'm a doctoral student of physical therapy at Regis University. This is Micah, my client. Today we are conducting an Astrand steady-state cycle ergometer test to determine her VO2 max through a submax test. We have her warming up for 2 to 3 minutes at 25 watts at a rate of 50 to 60 cycles per minute. We've determined per ACSM guidelines that her working rate should be 100 watts because she is a well-conditioned female, and I'm going to get her started at that rate now. Do you feel okay? Mm-hmm. Okay, let's go. Okay, I'm going to have you stay at 50 to 60 cycles per minute as you do this, and we'll have you go for 2 to 3 minutes before I start taking measurements again.
Okay.
So she's currently working at 100 watts. To get her to her submax heart rate range, which is 115 to 163 beats per minute based on her age of 23. That corresponds to 60 to 85% of her submax, or of her maximum heart rate. Before we started the test, we determined that she was ready to participate in exercise by following the ACSM pre-exercising screening algorithm, which means that she is already a relatively active individual. She exercises at least 3 times per week, and she has no diagnoses of renal, respiratory, or cardiovascular disease, and was currently exhibiting no signs or symptoms before we started exercise. We also took her resting vitals, and her heart rate was 68 and her blood pressure was 108/68, which are both in the healthy range to start exercise. We adjusted the seat height to the height of her greater trochanter so that she is only at a 5 to 10 degree knee flexion at the bottom of her cycle. And around 2 minutes, I will take her heart rate to make sure it is in that submax range. And then after that, we will do a 6-minute total test in order to get her heart rate numbers to estimate her VO2 max. So in about 15 seconds, I'll start taking her heart rate, and then we're going to take blood pressure as well. Can I have you put your palm up? Okay. Okay, your heart rate was at 120, which is right at the bottom of your submax range, so we're good to progress from there. And then I'm going to palpate your brachial artery. Yeah, nice strong pulse. To place the blood pressure cuff in alignment with that. Blood pressure was 128/70, which is an appropriate increase in your systolic and a level diastolic. Using this RPE chart, can you tell me what your RPE is at right now?
I'd say an 11.
Okay, awesome. We'll record that. Okay, perfect. So if we came across a time when Micah either requested to stop the heart rate or stop the submax test, or she was exhibiting signs or symptoms that indicated that she was having an abnormal response to exercise, or we had vital recordings that, such as a decrease in diastolic or systolic blood pressure, or a decrease or no change in heart rate, then we would want to discontinue the test. And using the normal protocols, if she is in steady state heart rate between 5 and 6 minutes in her submax range, then that will signal the end of our test and it will be completed. We've got about a minute left until we can start taking her heart rates and blood pressures again. Yeah. How are you feeling?
Good.
Good. Awesome. I'm just going to record her numbers from the last readings. I'm going to take her heart rate again. Can I see your palm?
Mm-hmm.
Okay. Okay, I got a measurement of 124, which is an appropriate increase, but you're still pretty similar to your last ones. And now I'm going to take your blood pressure. I got a measurement of 136/72, which is still a normal response to exercise. And now I'm going to take your heart rate again.
All right, so let me know any other questions. Yeah, definitely. I think the biggest thing on our first steps is
Okay, your heart rate was 128, which is just within that range of steady state. So you're good to start your cool down. Before we do that, what is your rate of perceived exertion on this chart?
I'd say it'd still be at 11.
Okay, awesome. That's awesome. It also indicates steady state, which is good for our results. So for our cool down, we're going to have Micah cool down back at 25 watts, which is the minimum resistance of this bike at 50 to 60 cycles per minute. And I will measure her vitals again at 2 to 3 minutes, and then once again once she gets off of the ergometer. And we do this just to make sure that her responses are returning down to baseline in a healthy way, just so that we make sure that we don't leave her in a vulnerable state. And exercising can increase risk of cardiovascular incident, and we don't want that to happen to our patients. Thank you, Micah, for participating in this, and thank you guys for watching.